box one, I call that finding problems early. Finding problems early. So in box one, the kind of questions you're going to get there are questions which help you with, assessment and diagnosis of health-related issues. And it's also a connection between assessment and diagnosis plus health promotion and illness prevention. That is why I've entitled box one as finding problems early. So now the question you should ask yourself is, how many questions are you going to meet based on the distribution and the finding problems early? Finding problems early, expect about 20 to 22 questions. So that is when you have to start thinking about screening, okay? Which age are you going to do your pap test? Which age are you going to do your FIT test? That is the fecal immunochemical test, as well as risk assessments like cardiovascular disease risks, like cancer risks. And also, because we are talking about illness prevention, you should start thinking about immunization. So remember, this is where you're going to meet about 20 to 22 questions out of the 230 based on the distribution of questions. So what are you exactly going to study? Here, I want to draw your attention to the Canadian Task Force, okay? Canadian Task Force on Prevention of Medical Conditions, as well as you also want to focus on age and gender-based screening, as well as asymptomatic risk assessment. So what are the tactics you have to take if you want to deal with box one, which is finding disease early? Number one, know first visit counseling topics. For example, smoking cessation. And then understand who gets screened for pap test, FIT test, diabetes. When do they get screened and how do they get screened? So if you're excited about box one, so we finished with box one.